Hi everyone, this is Dr. Joshua Zimm. How are you? I'm going to be covering now some questions that I commonly get asked in the office through internet questions about rhinoplasty. Common questions or common myths. So let's get right down to it, shall we? So the first question I usually get from people is, hey, it's really simple, I just have a little bump. It's not a big deal to take that off, right? Okay, so here's the thing. Rhinoplasty is the most complex operation we do in facial plastic surgery. Requires a great attention to detail, and each part of the nose has to fit with the other. Not only should the nose fit the face, but each part of the nose has to match with the other. For example, someone has a big bump and say, I just want the bump taken down. So you take down a big bump, and now all of a sudden the tip is sticking out too far. So every part of the nose has to match with the other as well as the face. So very challenging, very complex. There's nothing really in rhinoplasty that's truly simple. Here's a fan favorite. Patients will often ask, hey, I heard my rhinoplasty, can my nose have a job, or my rhinoplasty is going to be done under insurance, right? Well, here's the thing. If it's cosmetic, the answer is no. Your insurance will not cover it. So any portion of your surgery that's cosmetic is not covered by insurance. There's a surgeon's fee, there's an anesthesia fee, and a hospital fee with that. That being said, if you have a functional problem like a deviated septum or breathing issues, those typically are covered by insurance, and we'll be happy to submit those to the insurance company, but the cosmetic part is not, and that's separate. Here's another common comment. It's not really a question, more of a comment that I'll get at social gatherings or relatives, and even some patients will ask me, the rhinoplasties or nose jobs I've seen, they all look obvious. I can spot them a mile away. Okay, so certainly if the work has been performed poorly and looks overdone and artificial, yeah, then it can be quote unquote obvious. But if work is well performed and done with preserving as much of the normal structure as possible, preserving function, it can really look natural and should look natural and does look natural. So when you see someone who's had a well done rhinoplasty, you're not going to know that they've had it done. All you're going to see is a very attractive person. You're going to be able to look at their eyes, you're going to be able to look at their hair, their skin, and their smile. You're not even going to look at their nose. That's when we know that a rhinoplasty has been well performed, is you don't even look at the nose. Another question that comes up every so often, not all the time, but sometimes someone will come into the office with some magazine clippings of, Brad Pitt or Angelina Jolie or some other famous Hollywood celebrity, or, we'll get inquiries on the internet, I'd like my nose to look like blank Hollywood celebrity. And the truth of the matter is, most of the time, those are not realistic goals. Everyone's nose should be individualized. Your nose has to fit your face. It can't, we're not going to be able to give you someone's nose exactly because of structural limitations like skin thickness and cartilage strength. But also, having a celebrity's nose on someone else's face wouldn't necessarily look good. Now that being said, when they come in to the office, we do a consultation, we do simulation, and go over what's recommended and what's realistic. So those are just common things that we like to just inform people about in the beginning. Here's another common myth or question we get. Won't my rhinoplasty or no job have to be redone? Isn't it going to have to be revised? Everyone I've known's had to have their nose redone. And the answer is, as technically demanding and challenging as rhinoplasty is, yes. Is there a revision rate? Yeah. And overall, probably 10 to 15% of people that have a nose job or rhinoplasty done will need to have some touch-up work done in the future. And that's just the nature of the surgery itself. Now, that being said, it's not all that common and probably occurs 10 to 15% of the time. And really when a rhinoplasty is performed, it's really meant to be a one-time operation. That your nose really should be built for life, and it should be functional as well as aesthetically appropriate. Okay, next question or myth. That rhinoplasty is only for wealthy people. Well, the truth of the matter is that the median income for people seeking rhinoplasty or any real cosmetic procedure is about $50,000 a year. So it's not something that's only for wealthy people, and also most practices will offer financing options for people, and people will often save up for this kind of thing. So another common myth or misconception when people are considering rhinoplasty is that, oh, I'll outgrow it. At some point I'll be okay with my nose having this big bump or what have you. And the truth of the matter is, and we've done studies on this in general in our field, if you have a dislike for your nose at a young age, you really won't outgrow it. You may go through a waxing and waning period, but you'll never really outgrow your dislike for the nose. You'll always look in the mirror and not like it, typically. That being said, the decision to pursue a cosmetic procedure is completely personal and individualized, and it should be not undertaken lightly. There should be thought that goes into it, and family support as well.